Welcome back, everyone, to the Men on a Mission podcast. I'm your host, Brad Richard, and shortly we will be starting our next episode. We will be providing you tools, resources, and information that you can use to make your life just a little bit better. But before we do that, let's honor our country, and then we'll begin the podcast. Welcome back, everyone, to the Men on a Mission podcast. I'm your host, Brad Richard, and today we have another special guest that will be talking about mental health and wellness. His name is Ben Turney, and he is with Mission Partners Services in Tyler, Texas. So he is a neighbor of mine. He's real close to where I live, and we're really glad to have him on the episode and podcast with us today. Welcome, Ben. How are you?
Good morning. Doing well.
Yeah, it's nice to have you here. I appreciate you agreeing to being on the podcast. And first of all, let's start off with, my podcast is very casual. It's more of a conversation than it is it's not a tutorial. It's not just, questions. It's not just Q&A. It's best if we just have a conversation. So tell us a little bit about Mission Partners Services, and what do you do in and around the Tyler, Texas market?
Okay. Well, Mission Partner Services it's a mental health clinic where we provide what's referred to as intensive outpatient treatment. And essentially what that is that's kind of a level of care that's between being hospitalized, inpatient, and seeing an individual therapist. So what it does is it provides intensive treatment for folks that are really struggling, primarily with mood issues, things like depression, anxiety, grief, trauma. And those situations have gotten them to a spot to where they're not functioning very well. So, maybe in the case where somebody has been actively suicidal or out of control and needed some kind of acute treatment in an inpatient setting, well, they'll go and they'll get stabilized there. But all those situations that took them to that spot are still there. And so what ideally would happen is somebody would leave an inpatient setting and come to us and learn some skills and some tools and ways of dealing with things so that they can handle those stressors a little bit better. And then on the flip side of that, if somebody's seeing an individual therapist and their situation is worsening, they're not getting any better, well, then we're kind of a step up. So to prevent somebody from needing to be in the hospital, they can come to us and they can learn those skills and tools, again, just to kind of deal with things, life skills, life lessons, coping skills, coping tools, just to kind of learn how to focus on what's good, on what they can do, and so they can get back to functioning better. That's kind of our role, is to help folks get back into life.
Mm-hmm. Well, as far as, this podcast, it is geared towards veterans and their family members.
Right.
It sounds like you're kind of the next step. I meet a lot of people that have been in therapy. They've been in therapy, or they've had a counselor for a lot of their life. Some people that I've spoken with have been in therapy their whole life.
Right.
And to me, I think, if I understand you correctly, your services is kind of beyond that. When
Right.
just one-on-one therapy is really not enough, you guys kind of take it to another level.
Correct.
And you do it in a collaborative or in a group setting, which introduces the aspect of camaraderie and relatability. Can you talk a little bit about that? Because I think that's a real important aspect of what you do.
Well, if anybody has ever been to school or to college, you realize that there's things that you don't know, and you realize that there's things that you wish you did know. And the skills that we provide are those life skills that maybe you've never learned at home or in school or in church or anything like that. And the benefit of the group is that you get that peer support, and you have an opportunity to talk about your issues, problems, struggles in a way that you never have before. Seeing an individual therapist is great. It's a great way to kind of unload. But what we do that's a little bit different is we do a lot of education. And we also provide a lot of support, and we have a lot of structure. So the benefit of that is our program, it's 3 days a week for 3 hours a day. And so that it kind of forces somebody to get out of bed. And and one of those symptoms of depression is not wanting to get out of bed. And so they have a place to go. They have a place where they can be around other folks, and they have a place where they can learn. And so the benefit of having the other group members is, people realize that there's other folks out there struggling. But on a second page is one person in the group may have been struggling with this issue for a long time. The second person in the group may be totally brand new to it. And so that person that's been struggling with a long time can help that younger person and kind of teach them some ways of looking at things different, and maybe helping that younger person avoid those pitfalls and avoid those behaviors that just do not work. The therapist can do so much, but real life experiences is different. So it's that combination of that education plus experiential opportunities helps the new folks. And that it really helps the older folks realize that maybe some of the things that they've been struggling with, maybe it was for a purpose. And, maybe they realize that, they've done some things wrong. Maybe they've done some things right. And, it's kind of a way of helping themselves as well. And then, the new folks that have never struggled with this before, they realize, hey, there's a whole room full of people that, are struggling. And it's okay. I know that these people have gotten better. And so they realize that with help, with treatment, that they can get better. And so that's kind of the benefit of that, is the structure, the support, and the education really works in a group setting.
Yes. When it comes to veterans, structure is kind of a red flag for veterans. That's real important. Right. The transition from a military lifestyle, which is extremely structured and extremely organized, and you pretty much count on your day. You know what to expect. When they make the transition from military life to civilian life, the lack of structure in the civilian world is very disheartening and very disturbing to a lot of the vets that that I speak with and that I work with. That structure, that mission, that game plan, all tied into a team, a group of people moving forward together with a common goal. In your case, the common goal would be for everyone to get better and get stronger. And so Yeah, I think it's a great approach. It is something where I think my listeners, whether they be a family member of a veteran or a veteran, um, they may listen to this and say, "Oh, I've been in therapy for years. I've had multiple therapists. No one's going to help me with these issues because no one's been able to crack me. I'm a hard nut to crack type of thing."
Oh yeah,
And um, I want the listeners to understand that this is different,
it
and
is.
it's a different approach, and it provides you not only a support net, but there's a whole level of relatability, and that gives people security if there's other people that can relate to them.
Right.
And I think group sessions are extremely beneficial. Um, when it comes to veterans now, when we talked before the podcast. Do you have a background working with veterans?
Somewhat. I worked at a local psychiatric hospital, and we provided, a lot of treatment to a variety of folks.
Mhm.
But definitely one of the populations that we had was both active military, retired military, or just got out military.
Okay.
So yeah, we've had several, uh, you know, clients, individuals, patients that came through the program that they had learned one way of dealing with things. One way of dealing with stressors and pressures, and then, like you said, once they got out of that world where there was more than one way of dealing with things, it kind of threw them for a loop. And so they were able to come in and realize, hey, there is more than one way, and so the military men and women that we saw, it was kind of nice to get them, like you said, better, because some of them would come in kind of apprehensive towards treatment. You know, Sometimes it was kind of forced upon them. Their spouse said, "Hey, you're going to have to get some help, or I'm out of here,"
Hmm.
or their job said, "Look, you're not performing the way that you need to be performing," or in the worst case scenario, they've gone with substance abuse. They've started drinking or using street drugs, or even prescription drugs to kind of cope with things, and they've realized, hey, wait a minute, I don't have to do it this way. There's other ways of improving my life so that I can have an improved life, so that I can transform. And
Hmm.
so what we provided, and what we can continue to provide, is just kind of ways of looking at things differently. Not that the way of the military was wrong, but there may be more than one way. The whole more than one way to skin a cat, cliche, it's there. So what we do is we give those men and women those opportunities to try things. And that's the beauty of our program, is that you come in for a few hours a day, but then you get to go home, or maybe you get to go back to work, or you're around your kids, you're around your spouse, you're still around those stressors and those pressures. And so you have a chance to practice. And if what you tried that one time is successful, great, then keep doing it. But if you go home and you tried one of those certain skills with your spouse, and it just was a complete flop, you didn't do it right, or whatever, then the next time that you come in, you can talk about, hey, that didn't work. Well, then you can learn a new technique. And so it's kind of a constant build. And so maybe that technique that didn't work the first time, it may work the 10th time. And so it's just kind of a way to kind of build this really, it's a tool belt
Hmm.
of life giving and life saving skills to help folks transition and to transform, so that they can be that better spouse, that better parent, that better employee, that better community member. And so that's kind of our goal, is to help these folks that maybe they've been so tunnel vision and how to deal with things. And, that tunnel vision has almost come to a dead end. And so what we allow these folks to do is to kind of open up and say, hey, there's all these different roads that we can go down. And, not all of them has to be bad. And so it's a healthy way. And so with military folks, like you said, the camaraderie, the group processing, the kind of the learning different ways, and being able to identify what those triggers are. Sometimes people just don't know, but getting those healthy ways of dealing with things. That's what we want. Is we want to help those folks transform to getting back to who they want to be.
You mentioned a tool belt. I could equate a tool belt to a rucksack. For our military vets listening, our rucksack is basically our life on our back, and all of the things that we need to protect us, and all of our security kind of lies in that rucksack. And when it's full, we put the most important things, tools and things to keep warm and to be safe, and then some comfort items as well in the rucksack. So the rucksack is guys, just look at your rucksack when you're listening to Ben, as this is a way to get your tools and get your comfort food and the things that keep you safe. They can help you fill your rucksack, and so that you're prepared for whatever you may encounter in life. So just to kind of put a military spin on it, the rucksack or tool belt is a great analogy. The question that popped into my head while I was listening to you is the veterans that you dealt with. When you said you were working in a psychiatric, was it a psychiatric?
It's a hospital.
Hospital. Okay. And the veterans that you encountered, was there any reoccurring issue that you saw that kept coming back and that you saw repeated in the veterans that you met with, that you spoke with?
Well, some of the guys and the gals that we had that came through, PTSD is very prevalent, and those folks that were kind of struggling with it, they had the nightmares, they had the feelings, they had the insecurities. Once they got back, from their deployment, they really didn't know what was safe and what was not safe. They would see things that maybe reminded them of an unsafe situation, and were kind of unsure. And it took some time to kind of help them realize that, sometimes a trash bag on the side of the road is just a trash bag on the side of the road. It's nothing more than that. And getting them to realize that there are some bad things in the world. There's bad people, there's bad situations, there's evil in the world, but not everything is evil. Not everything is bad, and not everything is out to get you. And so a lot of times it was a defensiveness. They were reluctant. They were, lack of a better word, kind of scared, because they were in a situation where they weren't trained how to deal with it. And, you don't, I'm thinking of a particular guy that came through, Army medic for 11 years, came back home. His wife said, "You've been gone too long. I don't want to be married anymore." They didn't teach him how to deal with that in the military. And so he had to learn how to live life, without his wife, and without getting to see his son, and without drinking all the time, because that's what he went to first. It's like, well, nobody loves me, if at all, let me just drink. And he knew it wasn't good. He got to a place to where it wasn't good. So yeah, and the men and women, they get into these situations frequently that you were never trained how to deal with, how to cope with. Right now, the pandemic, nobody ever trained us how to be in a pandemic. And nobody ever coached us or trained us how to work from home or how to isolate or how to mask up all the time. And so there's all these scenarios that just happen in everyday lives with grief, loss of your buddy, loss of your spouse, loss of the camaraderie. They don't teach you that. They don't teach you that in the military. They don't teach you that in school. They don't teach you that in life.
Right.
But life still happens. Those situations still happen. And so you got to learn how to deal with it. And that's what we love to do. I mean, that's kind of our mission is to help these anybody, military or civilian, once they get into these situations, there are some different ways of thinking about things, and there are some better ways to think about things, and there are some healthy ways to deal with things. And it doesn't have to be this constant rock on your shoulders the whole time. Let's deal with a manageable rucksack.
Right. Right.
Don't tie a washer and dryer to your back just because you need it. There's ways of lightening your load, and there's ways of dealing with things as they come. And that's what we're hoping to do.
That's good stuff. That's terrific advice. And, we've covered a lot. We're going to jump to break and take a short sponsor break. When we get back in part 2 of this episode, I believe this is episode 42. And when we get back from the break, I wanted to just, I had a question about the PTSD aspect. And then I want to get into some details about what you do at Mission Partner Services, how people can get involved, insurance, the cost, and things of that nature. So just bear with me and stay on the line with me, Ben. And we're going to take a short break, folks, and we'll be right back shortly. Welcome our new sponsor, Scars and Stripes Coffee Company. They empower veterans to build their own business using their e-commerce platform. When you purchase from Scars and Stripes Coffee, you are buying from a veteran, and your purchase directly impacts the men and women who have served our country. Do more than say, thank you for your service. Order today and empower a veteran. Use vet code Brad Richard at scarsandstripescoffee.com. That's scarsandstripescoffee.com. Welcome back, everyone, to the Men on a Mission podcast. We have been speaking with Ben Turney. He is with Mission Partners Services in Tyler, Texas, and they are a mental health wellness clinic, is my understanding. And Ben has given us just some really great information in the first part. So we're going to jump into part 2 of episode 42. And we left off, you were talking about PTSD. And something that we talked about off there is when it comes to PTSD, do you approach it from an element of fear and paranoia? Is that something that you do in your group setting to try to eliminate that fear, or to dilute the paranoia? And how do you approach that when it comes to the overreaching, all-encompassing fear and anxiety that is associated with that, with the PTSD?
Okay. Well, the fear, the paranoia, the anxiety are all just symptoms of a bigger picture. So what we do is we do, a little bit of symptom management, but if you can work on the big picture, then sometimes those smaller things kind of resolve themselves. But that's the beauty of, again, the intensive part. You're looking at 9 hours of therapy a week. It's like a part-time job. And so you have those opportunities to address those symptoms. I know, we kind of talked about earlier about individual therapy. You may go for 45 minutes once a week or once every 2 weeks. That's not very long. So you don't have a whole lot of opportunities to kind of delve into things. Well, when you're looking at 3 hours a day, you have those opportunities to kind of touch on a variety of topics. And so, yes, we do address the paranoia. We do address the anxieties. We do address the fear. We do address all those stressors, because we know that that's on the people's minds and hearts and their spirits, and they need an opportunity not to be so fearful. And so that, again, that's just kind of the beauty of the intensive part of it, is if you don't get it that first 3 hours, or maybe you forgot about it, or the group topic maybe wasn't specific, towards your particular anxiety, well, the next day you're going to come in, you're very well made, and if it doesn't even happen that, and then the third day that you come in, you're going to have another 3 hours. So, and that's one thing I really like about, the 9 hours of therapy a week. I don't know if you think about that. That's just in a week. So in a month, you're getting 36 hours of treatment. And for most people, that's how much they get in a year. And so, it's think about if you had an opportunity to, combine a year's worth of treatment into a month, you're going to realize that it's there. So you're not going to forget, if you forget to talk about something with your therapist, well, in the 3 hours time, you're going to have that opportunity to come right back and address those things. So as the fear happens, as the paranoia happens, then you learn that, hey, this is real and this is a part of who I am, but this does not have to be who I choose to be. It's one of those experiences that, you can't change it. You can't get over it. There's no way to just forget about it. But you can move on. I've heard, an ugly phrase is, well, just get over it. And we know that that's impossible. You cannot just get over something, but you can progress through it, and you can progress past it, even more importantly, and keep going on, because your experiences create who you are, and you don't want to take away part of who you are, because it's something that can kind of help you, even in civilian life. Mm-hmm. And so we take that, and kind of like what you said earlier, is you have a chance to unwind. If you've ever taken apart a golf ball or a baseball, behind that high, there's this long continuous rubber band, and then until you get to a solid core. And so that's kind of what we focus on, is trying to help those folks unwind and find those things that are beneficial, and maybe helping them replace the non-beneficial thinking with something that's a little bit healthier. But that paranoia, that anxiety, it's still going to be there. But how you deal with it is kind of our goal, is to kind of help you move through it and move past it, and hopefully, make things a little bit easier for you. It's kind of what we want.
Well, something that I tell my clients, instead of get over it, something I tell them to say as a mantra is stand over it. Stand over it, and you control it. It doesn't control you, and that's right. And that's a hard step. That's a hard step to take 100% responsibility for it and say, this is my stuff, but I will take care of it, and stand over it, own it, and control, which way it takes you. But you have to make that decision to do that,
Oh, absolutely.
So standing over it, not in a negative way, not in an intimidating way, but stand over it, where you put yourself in a strong place, and you control where it goes or doesn't. So that's just something that I share with them. Just it's one of those little tricks to change the thinking, change the perspective, and and it does help, obviously. But from my feedback that I've gotten, it's helped quite a bit. But when you say it's 9 hours a week, 36 hours a month, tell the listeners how long is the program, or is that up to each individual on how long they stay in the program?
Well, it is individual. Now, for the, I did case management for 18 years, and so I saw several people, come through. And what we found out is 4 weeks is kind of a good, comfortable, level of care. Usually after about 4 weeks, most people have gotten, they've gotten 36 different topics. And they've had, a month's worth of being able to practice. And so it's, 4 weeks is kind of a good, comfortable spot, a good kind of transition spot. Now, some people, they don't need quite as much. They catch on a whole lot faster. They're practicing it more. They get a bit better. Maybe 3 weeks may work for some folks. Some folks are a little bit slower learning. That's okay. Even 5 or even up to 6 weeks. Now, we do know that kind of at the 6-week point is really kind of diminishing returns, because what we want folks to do is to be able to stand on their own. After about the 6-week point, we have found, and we've only had a handful of them, once you get past that 6-week point, treatment kind of starts becoming a crutch. And then it starts becoming unhealthy. And so, not that it's not necessary and not that they don't benefit, but once you've kind of heard the same topics several times and you're still not doing it, then this level of care, it's just not working for you. You try something 3, 4, 5, 6 times, and it just doesn't work. Over time, you got to try a different approach. So we shoot for about 4 weeks.
Yeah, that's why I'm not a big believer in the lifetime therapy.
Yeah.
The lifetime therapy, and/or prescriptions, medications, long-term, therapy, counseling, long-term, like you just said, it does become very counterproductive, and it's kind of a retrograde scenario. And I personally have had family members that have been in that weekly session for many, many years, and they just went further backwards the longer they were in it. And so I think it says a lot about the program, and I think your program is far more proactive. And if your goal is 4 weeks is normal, but you're setting up expectations for people. It's like, this is going to work. You will get better. You will feel better about yourself, and you're putting a time frame on it.
Right.
If it takes them 6 weeks, that's fine. If they get it in 2, that's great. But you're not advocating that they, visit your clinic for the rest of their lives. It's not a life sentence. And I think, especially when it comes to veterans, it doesn't have to go on for the rest of their lives, and because that's exhausting. That's mentally and spiritually exhausting to look at that, and that along with prescriptions. I have so many questions in my head, but I want to get as many bits of information out there to my listeners as possible. Do you bring in family members at any point during the program?
Well, at this point, maybe. We're still relatively new.
Okay.
We have, with some of the younger clients that we've had, we brought in mom, dad, or the parents, just to kind of, somebody that's maybe it's the first time that they've ever had a mental health problem, and the parents don't understand. So we want to have that support system be able to come in and ask those questions, and basically mental health first aid. What happens on the weekends whenever Bobby's not coming to treatment? What do I need to look out for? So yeah, we do want to incorporate the family as much as the patient feels comfortable doing. And so yeah, we definitely can, and we do encourage that. And so as our groups get bigger and we go on, yeah, we want the family to be able to participate as much as healthily possible.
Yeah, it's a great idea. Yeah, it's a great idea. Because leaving your group setting and then getting home to a brick wall, or getting home or going back to work where your coworkers haven't a clue, what you're thinking or what you're feeling. So that's great to hear that. Now, do you have any, my listenership is nationwide, international, but as far as the United States veterans, my listeners are within the 50 states. Do you have any affiliates, or do you have resources to other clinics similar to yours in other states? Because not all my listeners are going to be in Texas.
Kind of. There are intensive outpatient programs all over the country. And, of course, each one's going to be different, but each one, the goal is going to be that, 9 to 12 hours of treatment each week. And, usually for, a 4 to 6 week period. But yes, they're all over the country. There are probably more for substance use than there are for mental health, but they are out there. So if anybody is, kind of in a different state, a couple ways that you can do it. There are, you can contact your insurance company if you have that, and you can say, hey, are there any intensive outpatient programs? It's sometimes just referred to as IOP, in my area. So that's, they can definitely check on that. And just doing a search online for intensive outpatient treatment or intensive outpatient programs, you can look that way. If there's any mental health services that's kind of close to you, that sometimes they're offered, within the hospital system. So yeah, there's various ways of finding them, and there's even a website called Psychology Today. You can look it up that way too. And so there's various different ways of finding resources, kind of close to your area, but there's not a whole lot of them. That's just kind of the downside, especially for mental health, but they are out there.
As far as your information, like I said, I know you're based in Tyler, Texas. In the show notes, we'll have your website and your social media links in the show notes, so people can connect with you. Okay. Even if you don't live in the state of Texas and you're listening to the podcast today, you can reach out to Ben. You can reach out to them, and I'm sure they can help you, or guide you in the right direction to connect with a group of people in your state that is willing to help. If you like what they're doing at Mission Partner Services, maybe you can try to, find a similar company or a similar clinic in your state. If you like that format. So I understand some of the listeners are going to say, well, that sounds like a great program. I'd love to participate in that, but I don't live in Texas, So you did you did give some resources, and you can provide us maybe a couple of links to places that you would send people that are outside
Okay.
of the state.
Sure.
So we cover as many people as possible. Something you said, and we're getting close to the end of the podcast, but something you said is there are more substance abuse outpatient clinics than there are mental health.
Right.
And my mind immediately said, well, that's backwards. It's like, if that was reversed, the substance abuse could possibly be dealt with in the mental health stage, in the first
Absolutely.
step. So that, it sounds to me like, what you're saying, it's like, well, that's kind of back-ass words, I think is a term. There
Yeah.
should be more mental health, in perspective, as far as the drug addictions and the substance abuse. I know that's a big issue, and
Right.
that all ties into pain, fear, anxiety, and mental health.
That's right.
And they're trying to solve the substance abuse more so, but like you said, but there's less mental health, and it should be the opposite. So,
Oh yeah.
but that's that's the good old USA. Sometimes things
Yeah.
don't make sense, right? But
That's right.
if you could tell the listeners, we're coming down to the last couple minutes here of the podcast. Once again, listeners, we're guys and gals out there, we're going to put information in the show notes so you can visit Ben's website, and you can get more information through the links that he's going to provide. So don't worry if you miss something, we'll have that in the show notes. As we wrap up, Ben, tell the listeners in and around East Texas, as far as your program goes, the cost, do you accept insurance? The whole financial aspect, for someone to get involved with what you're doing there.
Okay. All right. So we are currently in network with Blue Cross of Texas, and so that's one thing. So we can accept that, and of course there's all those ramifications of co-insurance, deductible, all that fun stuff that you have to deal with. But that's the only one that we're technically contracted with. We do have some opportunities for what's called a single case agreement. We've done that with a local health first. We've done that with Aetna. And as more people come in, hopefully we're going to have some opportunities to do that, as well. What's called a single case agreement. If you're just paying right out of pocket, if you paid for everything up front, it's $1,620, and that covers 12 sessions. So that's $135 a day, and for 3 hours, so you're looking at like $40 an hour.
Wow.
And kind of in the long range thing. The 1620 is scary, for a lot of folks, but when you break it down, paying a master's level clinician $40 an hour, it's not too bad. And so, but we do have some opportunities. We're set up with a medical credit card. So if somebody wants to make payments, that way, we can definitely work with some folks on that. So yeah, we'll do our best to work with insurance companies if we're already not, a provider for them out of pocket. We tried to make it manageable, for those folks with the 1620. And if you didn't want to do that, if you just wanted to pay by the week, it's $450 a week. So it's $150 a day instead of $135, but that's $45 an hour still, as you break it down.
Mm-hmm.
So, we try to make it manageable, for
Right.
as many folks as possible. It's my understanding for an intensive outpatient program, 1620 for a month of treatment, it's pretty reasonable.
Yeah.
So
yeah, sure. Yeah. The price structure, the financial aspect of it is very reasonable, very attainable. I want to encourage, my brothers and sisters out there, the veterans that listen to my podcast, if you're in East Texas area, definitely reach out to Ben, and I think the program is super valuable. It is not a long-term mission. It's relatively a short term to give you a well-stocked rucksack, for your journey through life as you're toting all this stuff on your back. And so, reach out to him. If you're in another state, by all means, look for group outpatient sessions or clinics that do intensive outpatient therapy. And I think that is really, I think that's where the world of psychiatric medicine, I think it needs to move more towards the short term and more of the group setting and away from the one-on-one. Because, there's so many examples of one-on-one is not effective for so many people. It may be for a small percentage, but, mental health is something that we all should work on ourselves. It's our personal responsibility to ourselves to work on our mental health. And to, like you said earlier, as a crutch, to have a therapist as a crutch and to include that person in your life for the rest of your life to just keep you alive is really a wasted opportunity to help yourself. So, any last words? And we're going to wrap up. Ben, there's a lot more we could cover, but we're running out of time. So, is there anything else that you have here to wrap up before we're done today?
Just want to make sure everybody understands that it's okay. It's okay to not be okay. It's okay to be sad. It's okay to be anxious, but it doesn't have to rule your life. You do have an opportunity to get better. You do have an opportunity to transform, and we want to help transform people one at a time to be a better community member, to be a better family member. And you have that opportunity. So if you want it, it's there. And so that's really what I just want folks to understand, is that opportunity is there.
Perfect. That's a great ending, and I just can't really add anything to that. So thank you, Ben. I appreciate you being on the podcast today.
Thank you.
I want to thank the listeners for tuning in to the Men on a Mission podcast. The show notes will be posted on Anchor, as well as the blog. Just started a blog over at the website. So if you go to bradrichard.net, go to the podcast drop-down menu, click on blog, and there at the blog, the show notes and episode descriptions are there, as well as an embedded player for each and every episode. So you can sign up, you can subscribe to the blog. It's free, doesn't cost you anything. So if you want to go ahead and head over to the blog, and then you'll be notified as new episodes are published. So that's something new at the website, is a blog. So check that out. And we've been talking with Ben Turney with Mission Partners Services in Tyler, Texas. And they are a mental health clinic, wellness clinic, and they do intensive outpatient therapy or services. And they do it in a group setting where you have support and you have people that can understand where you're at, what you're struggling with. So that should do it for this episode. Thanks again, Ben. And until next time, take care of yourself, and don't forget to love your little me. Have a great couple of weeks. We'll be back. Bye for now.
First to fight for the right and to build the nation's might, and the army goes rolling along. Proud of all we have done, fighting till the battle's won, and the army goes rolling along. And it's high, high, hey, the army's on its way. Count off the cages loud and strong. For wherever we go, you will always know that the army goes rolling along. From the halls of Montezuma to the shore